Hello, and welcome to today's edition of our program on the Health Center with Ozion at Kunye. I'm still your regular host and anchor on this program, Ozion the Expressionist. Today, our topic is pancreatitis. And on this topic, I would like us to understand what this disease is, the organ it affects, which is the pancreas, how it affects the organ, the consequences of it, and as well as how we can prevent the disease and its complications. So, the disease pancreatitis is actually the inflammation of the pancreas. And one would ask, what is the pancreas? It's important for every one of us who are humans to know the pancreas or the organs in our body, irrespective of the profession of what you do. Because for this particular organ, the pancreas, it lies by this right side of your body. Yeah, where you have the liver, it embeds that, it goes through that side just between your stomach and your spine. Between your stomach and your spine, that's where the pancreas lies. And how it lies there is like this. Just by placing your right hand like this on your body, on your right hand, when you place it like this, means that the pancreas lies just this way, 6 inches from here to there, 6 inches. 6 inches, or you say 15 centimeter. Measure it up, something like that, just approximately 6 inches or 15 centimeter from there, lying like that, and it has a leaf-like shape. That's the leaf of the plant. It has a leaf-like shape. So one would ask as well, what actually is the function of this organ? Because every organ in our body has a very beneficial function for us. For the pancreas itself, it is the organ that does 3 major jobs, I would say here. And the jobs are, one, it helps in your digestion of fat. How does it do this? It helps in digestion of fat by the kind of enzymes that comes out from it, which it produces, which means it produces enzymes as well, which is the second thing that it does. It produces enzyme that helps in digestion of not just fat, of the foods you eat, because it helps in digestion of fat, helps in the digestion of carbohydrates, helps in digestion of protein. So what does this? Those enzymes that are majorly the lipase, amylase, and the protease, they all come down through the pancreas, pass out through a duct known as the pancreatic duct, which merges with another duct called the gallbladder duct or the bile duct. The bile duct now fuses with it and passes the bile acid, which also helps in the same digestion, but now of fat. The bile acid produces, or the gallbladder has this storage of bile acid. The bile acid itself comes from the blood, the red blood cell in your body that has been used up, now breaks down and stores in the gallbladder. Here it is used as bile acid and delivers to your intestine where it digests fat. While the pancreatic duct delivers the enzymes that helps in digestion of all the foods we eat, depending on the type, because it has it installed different types. So the function of the gallbladder will be explained when we treat that, but there is no way you will discuss the pancreas without mentioning the gallbladder. Why? Because the way they fuse actually most often causes the problem of the pancreas, especially at this topic, the inflammation of the pancreas, which is called pancreatitis. Itis, remember, is inflammation. So at this time, it is equally pertinent for us to know what actually causes this. What most often causes this gallbladder pancreatic inflammation is any problem, any obstruction of the gallbladder can cause pancreatic inflammation. That is number one. Why? Because of the way they fuse. When they fuse, like this, when anything happens to the bile duct and makes it obstructive such that it obstructs the pancreatic duct, it prevents the juices or the enzyme that comes out of the pancreas from going down to digest food, now to go back into the pancreas and begin to digest the pancreas itself. You see that? That's a problem. So when those enzymes go back, instead of digesting food, they now begin to digest the organ that produces them. That wouldn't deny us from getting to know the third thing that, or the third function of this pancreas, which is production of hormones. The production of hormones that helps in regulation of sugar. Regulation of sugar might be the regulation of sugar such that when sugar is high in their blood, there is a certain hormone called insulin that is produced by the pancreas in its cell that is known as Langerhans cell, the Langerhans cell, in a particular cell in the Langerhans cell known as the beta cell. It produces that insulin which now pushes the sugar into your muscular skeleton. For those in the medical field, you know what we call the mitochondria. We discussed that in other videos and the other processes that helps in production of energy. But here, the pancreatic processes that help in regulation of sugar, especially the high one, has just been treated. The other side of it, another hormone, is the glucagon, which when your sugar is low, it has to bring a certain level of sugar for you to help your body move. And this happens to us at every point of our time in life, but we do not even take cognizance of it. That is not important for everybody, but someone needs to let us know, and that is the job of Kunie at this time. You get me? Okay, now let's proceed. What does the pancreas do with the gallbladder? When that obstruction happens at the gallbladder pancreatic joint, the digestion of pancreas begins, and that affects the pancreas and it begins to melt. Another thing is there is evidence also that alcohol is a very big problem that affects the pancreas. People who take overdose, let me say it's overdose, or rather, who take regular intake of alcohol, or more alcohol, a lot of alcohol intake can damage your pancreas. Of course, it affects the liver and every other place, but in this particular one, it is a very major factor. Why? It's been found that when you take alcohol, because alcohol affects your gallbladder, when this alcohol comes into your gallbladder, what it does is that evidence has shown that it triggers your immune to respond in such a way that when it feels your body is having a kind of a gallstone, which means even if it is not the alcohol that causes your gallstone, once you have gallstone in your body, and as well as some elements of what you have in alcohol, your body immune system will come for send what you call inflammatory response. They will now, when the inflammatory response comes up to react to such kind of injury that such causes, it now triggers inflammation on your pancreas. So this is actually the major two factors that cause this. Other factors are there. Medications. There are some medicines that you take that will affect your pancreas. The kind of medicines you take and causes the way your body responds to it. When your immune responds to these medicines or medications, they now cause your gallbladder too, or either your gallbladder, or equally the major thing we are discussing now, the pancreas, to inflame. And that inflammation is the problem that we're talking about, the pancreatitis. Other things might still cause it if you have an underlying disease condition like autoimmune disease. Because what we are when we are saying discussing about inflammation, it is the immune response. So your immune, if you're suffering from autoimmune, it means that your body responds is so sensitive that it responds in such a way that anytime there is a kind of injury, the inflammatory response triggers and begins to produce different kind of signs or symptoms on your body. So such as well can cause. There are other factors as well that are already listed on the screen, and you can find in the article that follows this particular topic. So these are what we need to know about the causes of this, and try to avoid anything that will cause us this. Another thing that clinically causes us problem in the pancreas is smoking. So one that smokes has a lot of problems that could cause him both the pancreas, the lungs, and the rest of them that we have discussed about. But now, let's go ahead and discuss who gets this disease. Yes, who suffers from this disease besides these factors. Some other things can make you suffer from this if you have it in your family. Some people have suffered pancreatitis just because their parents or someone in their family has it. So we call it genetic mutation or familial link. That can cause it. And you use the other things we show on the screen. So also understand that there are so many things that can cause this. And another thing we need to ask is, how does this present? When someone is suffering from pancreatitis, How does it feel? The person feels a lot of pain. The pain of pancreatitis is so much. And it doesn't just feel on the right side. No, it comes towards the left. The way you have this head, sort of. Yeah. It pains you there and goes to the back. And it's a very painful symptom that anyone suffering from this disease do not want to really wish his enemy or her enemy to suffer. Then when the person lies down on the street, the pain increases. Whenever you eat, the pain increases. Whenever you cough, whenever you exercise, the pain increases. So the person will need to eat less. The person will need to equally stop anything that will trigger it. If you have been drinking, that one you shouldn't be told again. If you're lying down straight, you have to coil the way you lie, just like what you could see on the screen as well. If you're coughing, there should be, and the exercise should be stopped. Yes, you need rest when this is happening, and you need hydration, fluid. So these are the factors. These are the things that the person sees when this kind of problem is there. And there are two categories of pancreatitis. Because pancreatitis can be acute and it can be chronic. Most times you may have suffered pancreatitis without knowing because you take a certain medication or eat food, because infection as well can be a cause of pancreatitis. You may have a certain infection from the food you eat and your pancreas becomes inflamed. And when it becomes inflamed, the pain will be there for like some weeks, some days, sometimes some months. And when this exceeds to the extent you get up to 6 months, you'll definitely have to conclude that this is a chronic pancreatitis and something has to be done. How do you treat that? Management. For now, there is no way you can transplant pancreas. Pancreas does not have any transplant, that is like the liver or your kidney. It's not transplanted. It can only be managed to the extent that if it becomes worse, it should be removed from your body and you begin to take replacement hormones and enzymes to help you do the functions that your pancreas do for you for all through your life. People live with it. Yes. So if your condition has reached like that, don't panic. The fund is there because medicine is not equally very cheap everywhere in the world. That is the next level that will be sought to help you live better again. So pancreatitis is a very big problem that has to be diagnosed. How? Have to do blood tests to find out if you already have your enzymes working very well in your liver. Liver enzymes have to be checked, as well as certain other things, ways like the feces, because one who is having this pains equally has his feces very oily. Yeah, the feces of the person is very oily because the fat that is being digested, the foods are no more digested very well. So certain things that come from the food are elevated. So that is a problem that one wouldn't want to see in the body. And when these are coming up, then there is a suspect that somewhere around the liver there's a problem, there's a danger that needs to be addressed. So these tests needs to be done, and the person has to be managing this while the treatment goes on to ensure that you do not have an exacerbation of this problem, because your heart will be beating very fast. You have a breathing problem based on it will be like not as good as before. Yeah, you have that challenge. Have even your blood pressure will be low. So some other symptoms will be listed, and we see that it is not something that is very, very good, or it's not like many other diseases, because it's a very sensitive area in your body, just like your liver and the rest of them. So if you have any question on this particular topic, it will be pertinent you ask it on the comment section while we discuss further. Pancreatitis is a very big problem that if it continues without your attention, it could lead to pancreatic cancer and some other problems, because even your gallbladder is endangered. So that definitely should be removed. There are ways of removing the gallbladder. We treated that in the topic, but let me just mention it here. We have the laparoscopic surgery and we have the ERCP, the endoscopy to retrograde the cholangiopancreatography. So this is a medical term. It may not be good for you, but you may still want to know. This time I would have to make this a closure for now, and still expect your questions and I'll attend to you as prompt as always. Remaining your host and regular anchor on your favorite health program on the internet. The health center with Ozion, and here is Ozion, the specialist. Wish you the best. Continue to take care of your health. Remember, as always, our slogan: health is wealth. I love you. I will want you to watch the next program. Staying healthy, exercising, eat healthy, and see you next time.